Hello, I'm Rico Cavella, and this is your Ageless Body Self-Care Guide, your operations manual for your body and for your mind. And the title of today's session is Mental Health. I don't think I have to say any more about that, how important that is, and especially in these times that we're dealing with right now. So we're very fortunate to have a great expert with us today. Her name is Laurie Goldman, MD. And she is a medical doctor, a psychiatrist, and a functional medicine practitioner who's been in private practice since 1999. She founded ClearPath Wellness to help her patients reach their maximum state of mental and physical health using a personalized, comprehensive approach powered by the principles of functional medicine, which treats the whole person, not just the symptoms. And using the science of medicine in the art of holistic healing, Dr. Goldman compassionately guides her patients on a positive, change-oriented journey that promotes growth, holistic health, and disease prevention, which is what this project is all about. So, Dr. Laurie, thanks so much for being here.
Thank you so much for having me. I'm very excited to be here today.
Yeah, well, I really appreciate you coming and sharing your knowledge and wisdom with us. So this is about mental health. So, and this is, I just want to kind of clarify, this is just, it's not about people who have really serious mental disorders that require, really some severe intervention. This is just about having good mental health, because mental health, as we know, everything that manifests in our physical body begins in our mental emotional state. So this is such an important topic. So how about we start by just having you define what you consider to be a healthy mental state? What is good mental health?
Good mental health is feeling good in your body, feeling bright, ready to take on the day. Includes our emotions, our psychology, our social well-being, how we think, our cognitive processes, how we feel, and the behavior. How do we deal with stress when it comes in? COVID is unprecedented, but how we deal with stress, how we relate to others, both our intimate relationships, extended family and friends and community, and how do we also make good choices for ourselves? You can have, as you said, you can have a serious mental illness and good mental health, or you can have poor mental health but still not have a mental illness. So I do agree that's a really good distinction to make. You can realize your full potential when you're in good mental health. You can adequately deal with the stressors in life. Your work is productive, and you have a meaningful existence, and you feel like you're contributing meaningfully. And overall, your emotions are more positive than negative. And you feel engaged and vibrant.
Yeah, that's what it's all about. It really is I love the term mindset, because mindset, it means you actually can set your mind. You have control over your mind, right? So, our mental state is everything. It's just if you're going to have high energy, you better have a lot of good positive mental attitude. Or if you have a lot of negativity in your mental state, then you're draining your energy. And so it's such an important thing. So, well, I just kind of mentioned a few things there, but talk a little bit more about really how your mental state and your attitude, and how it's so important to have a high level of wellness and success in every aspect of life.
Right, and it affects all your choices. So I talk about kind of when people have depression or depressive mindset, they see everything, not Pollyannish and rose-colored glasses, but I call it blue-colored glasses. And they see everything's a little bit darker than other people might see it. And that's going to affect your choices in what you eat, your choices in how you do other lifestyle things, like how do you sleep? Are you having a little bit too much alcohol? Are you using other illicit drugs of abuse? What is your relationship with your intimate partners and your family and extended family and community? And what about your choices in work? So it is everything. If your mindset is a little bit off, you're not going to make the best choices for all your health. And it's just a circular pattern that supports itself. It's sort of a spiral out of control. And I think we've all experienced it time to time. When we get in a negative place and have a little bit of a pity party, everything unwinds, and pretty soon you're eating a pint of ice cream and you're drinking alcohol.
Yeah.
But that happens to the same degree it happens very frequently throughout the day, and it kind of sneaks up on people and they don't realize it. So being very conscious of what your thoughts are and what your behaviors are and what your choices are is a first step. And you can change those choices, and you can get your support network to help you change your mindset.
So what would you say are really, I mean, I know it's complex and there's many things going on, but what are some of the real main causes of having poor mental health and depression and being stressed and all these things? So what are some of the big factors that we need to look out for?
Yeah, as a functional medicine physician, we look at the underlying physiologic state of the body, and that's all the choices and how that contributes to a depression or anxiety. Or if it doesn't manifest in the brain, it can manifest elsewhere, it can manifest in your hormones. So number one thing is inflammation. There's lots and lots of scientific research that talks about depression being an inflammatory state of the brain. And inflammation in our body, again, goes back to what are we eating? Because our choice in food directly impacts our amount of inflammation. If you have some sort of infection in your body, whether it's a little bit of a bacteria or viral, that's going to fuel inflammation. The health of your gut, the good bacteria and the bad bacteria, if they're out of balance, it's called dysbiosis. That is where inflammation starts. So the health of your gut, and there's a direct connection between your gut and your brain. Also the amount of stress in your life. And stress is not how you perceive stress, it's how I perceive it for my body. And we all have variations of that. So that's why one person's stress is another person's, not stress. Hormones are affected by all that as well. But if your hormones are out of balance, you're going to have some consequences in the brain that is going to push you more toward poor mental health. It starts with our adrenals. Our adrenals are the major stress hormone in the body. And there's something called the hypothalamus HPA axis. I won't bore you with all the details, but it's the adrenal hormones going. Those affect your thyroid, and the thyroid is the gland in the neck. And then your sex hormones. So it's a spiral, they're all interconnected. All the hormones are our body. So if you affect one, you affect all. So in this day and age with so much stress, all our hormones are being affected. Simple nutritional deficiencies or toxicities. We're a nation who's, as a whole, are overfed and undernourished. Very, maybe not in Southern California, but certainly here in Chicago, there's not enough vitamin D. I looked like a genius when I tested everybody's vitamin D and it was low. B vitamins are low. There's not enough minerals that we get from the food we eat. There's a lot of supplementation that needs to take place. Cholesterol, believe it or not, the traditional medical system is worried about cholesterol, but they've done, I think, a disservice for some people because the cholesterol is too low. And if the cholesterol is too low, it's going to affect your brain, which is 60% fat. And if the cholesterol is too low, you're not going to have good sex hormones because all those are built on cholesterol. So just understanding your nutritional status from a much more holistic, not your conventional docs at all. I talked a little bit about the GI system, which is your microbiome. That's everywhere where you absorb nutrients. That's the first line of defense and the first line of nutrition. And that's where the immune system is too. If you don't have a regular bowel movement every day, you'd be surprised how many people I talk to, they have a bowel movement every 3 days. Wow. And I was never taught you're supposed to have a bowel movement. In medical school, they're supposed to have a bowel movement every day. But as disgusting as it sounds, your poop tells you so much about your state of health. I know mothers look at their baby's poop. I look at my dog's poop on the walk. It tells you what their system is like. And our big thing is our immune system. Really, in this day and age, our autoimmunity is the immune system attacking part of your body. And there's so many toxicities in our environment where the immune system starts attacking organ systems because it's mistaking different things. And so we're doing it to ourselves. We have so many toxins in the environment, they're getting into our body.
Mhm.
And then just the natural inflammatory process, which is used to kind of protect and repair our body, is out of whack because there's so many of these foreign invaders. I'm almost done, sorry, got a lot to say here. Blood flow. You know, our red blood cells carry oxygen to all parts of the body. So classically, people are worried about the cardiac arteries, and if they're getting filled with too much plaque. That also happens in the brain. But another thing we don't think about as much is the blood flow itself, and structural skeleton and musculoskeletal system sometimes impacts blood flow. And the nervous system, a balance between the sympathetic nervous system and the parasympathetic nervous system. In this day and age, we're all usually in sympathetic overdrive, which again brings in those adrenal hormones. Meditation is so wonderful here because it gets us into that parasympathetic state. Our bodies are meant to be balanced, not with one over the other. Also, people's history of traumatic events. We can't help when we're exposed to a traumatic event. A traumatic event can be witnessing somebody getting shot. It can be a rape. It can be a car accident. Traumatic events, whether you're a child, which is going to have a huge impact on your nervous system, and then later it's going to be compounded by make you vulnerable to chronic health issues. So you almost need to take care of yourself even more. And then traumatic events as an adult pile on top of that. So those can't be ignored because that really affects our nervous system. But it's not that it's bad and horrible. It's just telling you have to take more self-care. And then our relationships. This is the wonderful thing, that the quality of our relationships can compensate dramatically for all of these physiologic issues. People having meaning and purpose in what they're doing. And I think sometimes we forget that. We definitely don't have a school for that. And then I think spirituality, it could be a religious faith or just having a spiritual practice. The universe is bigger than us as humans, I definitely believe. So there, miracles happen, and I don't begin to say I understand it, but I know having a spiritual practice is extremely helpful to people as well.
I totally agree. So what I'm getting from you is that really our mental health really depends, we're really products of our environment. And so our diet and our food that we eat really affects our mental state and how we feel. Lack of exercise,
yes,
events that happen to us, all these things, pretty much lifestyle choices are really affecting our mental health. And then if we get into a state of what we would call, not good mental health, or feeling a little depressed, or we're feeling stressed, then it's kind of a vicious circle, right? And then that creates more problems in your physical body, and you don't take the very best care of your physical body. So it's kind of a vicious circle, isn't it?
It really is.
So what would you say, give us an idea of what you would tell your patient, how to identify if they really need to get a lot better control of their mental health. What would indicate that?
There's two ways I look at it. One, the most simple way is, do you feel you're controlling your feelings and emotions and going through your day? Who's in control of your day? Is it you, or do you feel you're at mercy, so to speak, of your feelings and emotions, and it's an up and down throughout the day? We have feelings and emotions. We want to have feelings and emotions, but if they're overwhelming you and consuming you, I would think that's not great mental health. You should be able to be productive in your normal day. You should be able to put the emotions aside. A famous thing is certain mail I don't look at until I know I have time to look at it and process it, because it's always bills and I never like bills. But things like that, like don't have that argument on your lunch at work with your spouse, because you're gonna most likely be consumed with that the rest of the day. So just be very thoughtful and choose when you do it. If you feel like your feelings are controlling you, it's time to find somebody to help you. Another really easy way are some physical symptoms. You just feel like you don't have energy. You feel like you can't sleep, or you're sleeping too much. If you're not enjoying things the way you used to, let's say you had a day where you could do anything you want, you can't think of anything. Or, when you would do pottery, you would, just love it. And if you just never felt like doing pottery, if you feel like nothing matters, if you get a lot of physical symptoms like aches and pains, feeling helpless or hopeless, if you feel like cognitively, you're like, some people describe brain fog, if you're getting more arguments and being more irritable. And again, it's obviously if you're thinking of hurting yourself or somebody else, or life isn't worth living, that's an extreme.
That's
But
extreme.
again, daily tasks. So it's a combination of all of those. And there's so many professionals about to get help from. And there's so many different kinds.
Yeah, that's so good. But would you also include that you just can't turn off from your day? Isn't that true, that you can't just let go of whatever you're doing or stress or anything that may be causing you some problem, and just relax and maybe and let go of that stuff, and learn how to
Right.
just relax and let it go? If you can't let it go, then you're definitely having some,
Yes.
you need to get control over that.
Yeah. If it's consuming you and you get caught up with it and you're living it over and over and over again. Yes.
Okay, before we ask, I want to ask you a few more, really some recommendations you have for people. Uh, I want to ask you, why do you think that we've got ourselves into this stressful lifestyle of rushing, and we have to accomplish so much and we can't turn off? I mean, there's a lot of factors, all the devices are one of the factors that we keep thinking that because we can't accomplish more, we think we need to, right? And
Right.
we can't turn it off. And so how do we get this stuff into this lifestyle that we got to be so busy, and everybody thinks that there's stress, but we just get caught up into it.
I think that's a little bit of getting too focused outward
Mm,
and
yeah.
taking other people's, thinking that's what other people trying to keep up. Like, I know I don't feel like I'm poor with technology, but I'm like, oh my God, I can't believe I don't know how to do this app or that app. And one 20-year-old next to me is like
Yeah.
doing something. And, I used to get really upset about it. And for the longest time, I thought I had to keep up. No, I don't, because I don't need that app. And you can make your own choices. And you can, but that's a matter of setting a boundary and accepting yourself and turning inward and looking at your value system and not
Yeah.
other people's value system.
Yeah.
So it takes a fair amount of reflection to do that. And, we're in a capitalist society, which is wonderful, but the corporations that have everything available, that, their job is to make everything that you want to buy it. And pretty soon we're working to keep up with everything we think we have to have. But you don't have to have the fastest internet, or you don't have to have the latest MacBook.
Yeah.
But they make it really like, I like my iPhone, they make it wonderful to look at. But looking at your values and what's really important to you. And to me, it's the relationships, taking care of our physical body, my relationship with myself, my relationship with the universe, and the relationships in our world, and how much money is good to have or not. If you're working to keep having things that you don't really need, why do you need, a house with 5 bedrooms and 5 bathrooms when there's too much?
Yeah.
But I think it happens. Like, they make it very attractive.
Yeah, I totally agree. I totally agree with you. I'm all the time now, I'm trying to simplify my life more and get rid of clutter and simplify, and just and be more, like as you said, more introspective, and go inside more and not be so affected by what's going on, and let other people, and let other people disturb your peace, and try and
Right.
to compete and keep up with that. I think that's some really good advice. So, what, so let's do talk about that here. The last thing here, let's kind of talk about what some, if you know that you are a little bit out of whack there, you know, you are not able to let go, and you're not feeling really well mentally, and you're not feeling really well in your body, and you're not really loving your life and enjoying your life that much. So what are some, what would be the top 3 things that you would recommend that people need to begin to do?
I would, you know, doing top 3 is always hard, but get some professional help. There's so many different kinds of professionals these days that are there and want to be helpful. It can be a physician, it can be an integrative psychiatrist, it can be a therapist, a counselor, it can be a coach. There's different types of counselors and therapists and coaches. I go back to what resonates with you. I'm really, really big into that. You know, there's that saying, what does your gut say? Listen to that inner intuition. You know, if it doesn't match, don't worry if you can't figure out why, but if it doesn't feel right, don't follow. If it feels right, go with it. The people want to be helpful. I think it's part of the human condition. Also getting physically active. In general, our country is very sedative. You know, I sit and listen to people all day. I sit a lot. So getting physical activity, our body is made to move, and so many things get set in action. Everything gets oxygenated, you know, different hormones get stimulated. That is huge. And then also actually getting enough sleep.
Yeah, sleep is so important.
Our body is really busy during sleep. It's really, really busy, and we forget that. And if you don't get adequate sleep, your physiologic body isn't taking care of itself. You know, dementia is a prime example, where the brain cells, I call it taking out the garbage at night when you're sleeping. And if you don't have enough sleep, it doesn't do that. So it's going to affect you the next day. So professional help, physical activity, and sleep would be my 3 top things for sure.
I totally agree with you. That's just good advice. Yeah, first you have to slow down enough to realize that you are a little out of balance, and you need some help, and not be worried, and realize there's plenty of help available for you. And there's plenty of things just to get educated these days. I mean, there's so much information.
Like this is
yeah.
like one of the things. Listen, seriously.
That's what this is all about. That's what this project is all about, is giving you some really right information that you can trust from top experts that can really make a difference in your world. And so I also want to remind you that this video training, it comes with a PDF as well. So you have the contact information of Dr. Goleman, and so you can go there, and I know she has information on there that you can learn from. Probably has books and trainings, and or if you just need to actually see her, you know, medically, it can be really valuable for you. So I really recommend that you really stay connected to all of our experts, because they have really the right information and things that can really make a huge difference in your life. And if you actually will take action on the recommendations from all of our experts, I promise you it's going to really improve your overall health and well-being. So that's always the last question I have for all of our experts is, and it's the toughest one of all.
It is.
This is it. It is, what ideas do you have to actually motivate people to really take action on your recommendations? You know, I like to always say that, you know, knowledge without action is useless. So what ideas do you have to get people motivated to say, okay, I'm right, I better take a look at how I'm feeling and how I'm thinking and what's going on in my life?
Yeah, I think it is, as silly as it sounds, take it one step at a time. Don't think too far ahead.
Mm-hmm.
I would say find somebody or something that is helping you change your perspective, whether it's this series or some of the lectures or some of the interviews from the series, or is it a book, or is it a friend? And get some encouragement and just focus on the first step. But nothing's going to change if you don't take any kind of action. And I agree with you. You know, I'm somebody who's been in school forever, and I learn more, and I don't think I know enough, so I learn some more and more. But that doesn't help anybody. It doesn't help until I go out and actually start helping people. And then I can integrate more knowledge over time. So that is focus on the step you're in.
Yeah, that's so good. And I just want to add is that there's there's no lack of knowledge, and there's no lack of information and people that can help you, but you have to act on it. You know, there's plenty of, we can solve just about any situations and problems that we have, you know, but you have to step up and take responsibility and just act on all this great information, like the information we're giving you here in this program, and it'll make a huge difference for you. So you just gotta get out
And
and
people want
do
to
it.
help. People
Right.
really want to help.
People want to help, and the help's available for you, and we know that you can do it, right?
No, it
Very
really.
absolutely can. No matter what you're dealing with, there's solutions, and you can get past it, and you can meet your challenges and live a much healthier, energetic life. And that's what again, what this project's all about. We want you to be your best self so you can live a long, healthy, and energetic life, and also use your talents and abilities to help find solutions to all these major challenges that we're facing as humanity. And so we need you to be your best self and go out and make a difference in the world. So we know you can do it, so just go do it. Dr. Lori, thank you so much. That was wonderful. That was great. I really appreciate all your wisdom and your knowledge.
Thank you so much for having me.
Thank you.